Good morning. Today, in prosthodontic fixed partial denture, I'm presenting you about description of color and color application and aesthetics of the teeth. Master students Ruyaa Mohamad Ridha, supervised by Dr. Suha fadhel in College of Health and Medical Technology, Middle Technical University. In the beginning, we're talking about the color in general, which the color mean a property of light. Objects have no color, but they just reflect a particular wavelength from the color spectrum. The color and appearance of teeth is a complex phenomenon. Students, focus with me. When we want to achieve aesthetics, four basic determinants which are required in sequence: position, contour, texture, and color. That is used to understand the nature of the light, which is important for successful aesthetic restoration, particularly when metal ceramic or all ceramic restoration are being made. Now, there are two types of color: additive and subtractive. The additive color obtained by emitted light or released light and are associated with television and computer displays, while subtractive color, these are colors associated with the reflected light and are used in pigments for making paints, inks, fabrics. As shown in pictures, for additive color, the primary colors are green, blue, red. Secondary colors are cyan, magenta, yellow. For subtractive color, primary color cyan, magenta, yellow, while secondary color green, blue, red. Now, what is the meaning of a hue? Hue is defined as a particular variety of color. Hue of an object can be red, green, yellow, and it is determined by the wavelengths of the reflected and transmitted observed light. Uh, you should not forget the shorter wavelengths, the closer hue to the violet portion of the spectrum, while the longer wavelengths, the closer is to the red portion. Chroma is defined as the intensity of a hue. Saturation and chroma both mean the strength of a given hue or the concentration of the pigments, while value is defined as the relative lightness or darkness of a color or the brightness of an object. As mentioned previously, in syllab system, the three coordinates L and A and B. There I explain what's the meaning of each coordinate. The L coordinate is meaning the lightness variable proportional to volume in the metal system. It describes the chromatic character of the color, while A and B coordinate describe the chromatic characteristics of the color. A coordinates corresponding to the red, purple, blue, green axis in the metal color space. Similarly, the B coordinate corresponding to the yellow, purple, blue axis. Color replication process means replicating in visual shade matching. Three main factors that influence the outcome of shade matching, which improve the accuracy and reliability of this process, which are lightening and subjectivity of a human vision and the object. Light is necessary for color to exist. The quality and quantity of the light source and environment during visual shade matching of the team are important. Remember, ideal light source for visual shade matching is must be controlled, stable, and constant, and standard full spectrum lighting than in daylight. In human vision, light from an object enters the eye and acts on receptors in the retina as rods and cone. There are two vision, scotopic vision and photopic vision. Scotopic vision means under low lighting condition only the rods are used, while photopic visions mean under higher lighting condition the cones are used. We must note when change from photopic to scotopic vision. This is called dark adaptation and takes about 14 minutes. Also, must know, color is modified by the object and the total appearance of the material depend on the object's capacity to modify the color of the incident light. We will look and explain the optical characteristics of the natural teeth, which are metamerism and fluorescence and opalescence. Metamerism is a phenomenon in which two colors that appear to be matched under a given lighting condition but have different spectral reflectance. To explain the metamerism with the example, when two objects that appear to be an identical shade of yellow may be absorbed and reflected light differently. Yellow objects normally reflected yellow light, but some may actually absorb yellow light and reflected orange or green color. The problems of metamerism can be avoided by selecting a shade and confirming it under different lighting conditions, such as, for example, natural daylight and fluorescent light. The second optical characteristic is the fluorescence. Mean teeth absorb the energy and convert it to light with longer wavelengths. Tooth become an actual source of light. It emits or released the light of 400 to 450 nanometer. And the fluorescence of teeth and restorative material can be influenced by several factors such as aging, temperature, and bleaching. The third optical characteristics is opalescence. Opalescence means the ability of the object to appear blue or red-orange in the reflected or transmitted light. As mentioned previously, the shade matching technique visually or with instruments, their color measuring instruments or shade matching devices are such as spectrophotometers or spectroradiometers, colorimeters, and digital camera. As a note, spectrophotometers and spectroradiometers measure light reflectance at wavelength intervals over a visible spectrum, while colorimeters provide direct color coordinate specification without mechanical manipulation. When talking about spectrophotometers, there are two basic optical light settings used in reflectance spectrophotometers instruments. Number one, illumination at 0 degree and observation at 45 degree called 0 on 45 and illumination at 45 degree and observation at 0 degree 45 on 0 because of the limited access afforded by the oral cavity. Only 45 on 0 option is suitable for a clinical use. Now, calorimeters called filter calorimeters generally use 3 or 4 silicon photodiodes that have spectral correction filters. These filters act as analog function generators that limit spectral characteristics of the light striking the detector surface. Now, another device is a digital camera. Digital camera is extremely efficient and easy to use and has the advantage which record each of the 3 colors at each pixel location. Shades can combine digital color analysis with colorimetric analysis, but spectral shade is the only one that combines digital color imaging with the spectrophotometric analysis. Now, shade selection system. There are many systems that help in shade matching of the teeth, which are Vita Lumen Vacuum Shade Guide and VitaPan 3D Master Shade Guide and Custom Shade Guide. In Vita Lumen Vacuum Shade Guide, the shade matching is done by choosing the nearest hue first and then selecting the appropriate chroma and value. While in VitaPan 3D Master Shade Guide, the shade matching done by selecting the lightness first, which is the value, and then chroma, and finally selecting the hue. While in custom shade guide, certain teeth may be impossible to be matched to commercial shade samples. Therefore, the shade matching is done by making a custom shade guide. The disadvantage of these procedures is time-consuming and generally confined to special practice. Shade matching procedure. Firstly, lightness and chroma and then hue should be matched, and the next step is to choose the closest tab or combination of appropriate shade tab. Several factors should be considered such as during shade matching procedures such as dentist positions and lab placement, tab placements and time, length and pauses during shade selection. The dentist position, the dentist eye should be at the level of the patient's tooth, and the tab placement should be placed. The tab should be placed parallel to the tooth being matched, and the same with the same relative each position. Time, length, and pauses during selection. The best match and shade matching trial should be limited to 5 seconds. To prevent eye fatigue and to relax the eyes by observing a blue card between 2 trials. Problems during shade matching. There are several problems during shade matching as number 1, color vision problem, color blindness and aging and fatigue, emotion and medication, binocular differences, and finally environmental influences. Number 1, color vision problems, color blindness. The color blindness means the defect in the color vision that caused by deficiency or absence of one or more of the 3 types of photosensitive pigments. This defect affected about 8% of the male, and it does occur in the female. The types of the color blindness are achromatism, mean complete lack of hue sensitivity, and dyschromatism, mean sensitivity only to primary hue, usually either red or green, is not perceived. Trichromatism means sensitivity to all three hues with deficiency or abnormality of one of the three primary pigments in the retina cones. Another problems as aging also caused the problem during shade matching, because the cornea and lens of the eye become yellowed with the age. Another factor is the fatigue. The tired eyes cannot perceive color as accurately as altered eye. Also, the emotion color can function as a language. For example, red suggested to anger, and yellow represents the joy. Therefore, the emotion can affect papillary diameter, causing the problem during shade matching. Also, the medication, the abuse of the drugs or alcohol or caffeine will affect not only judgment but also the color perception. Lastly, the environmental influences, such as the background and surrounding, can affect the saturation and the use perceived. Patients' complication and makeup and even reflection from the operatory equipment, which can influence the shade determination. Lastly, we explain about the relationship between the colors of the tooth and the aesthetic. Aesthetic is often the primary motivation factors for patients to seek the dental care. Anatomy of a smile. A smile in an aging individual shows less of the maxillary incisor and more of the mandibular incisors. The smile art refers to the relative curvature of incisal edge of the maxillary teeth and the curvature of the lower lip. Proportion aesthetics depend largely on the proportion of the teeth. Balance, including the location of the midline, which is an important prosthodontic concept. The observers expect the left and right sides of the mouth to balance out the teeth precisely. Also, the midline should be carefully evaluated in the planning of prosthodontic treatment. Another factor is the incisal embrasure form. The shape of the incisal embrasure can have a dramatic effect on the dental aesthetic. During evaluation procedures, the embrasure can be carefully increased intraorally according to the patient's wish. Lastly, incisor angulation. The mesial or distal angulation of the maxillary incisor teeth can have a dramatic effect on the aesthetics of the teeth. In general, slight mesial angulation is acceptable, but distal angulation should be avoided. This is the end of this seminar. Thank you very much for listening.